Did you know that for every minute a stroke goes untreated, you can lose nearly 2 million brain cells? Welcome to Senior Life Joy and Wellness. Today, we're opening up a vital topic: 5 stroke symptoms no one should overlook. The signals your body sends before everything becomes too late. If you are over 50 or a caregiver, recognizing and acting on these signs in the next few minutes is a life-saving skill. Never mistake these symptoms for common fatigue. We are committed to bringing you the most useful and engaging content for your golden years. Your support with a like, a share, and a subscription is the biggest motivation for us to continue building videos that can change your quality of life. The story of Mr. Leonard, the mistake of complacency. This is the story of Mr. Leonard, 70, living in the suburbs of Sydney, Australia. Leonard was an active man, but he made the most common mistake among older adults. He attributed all sudden health issues to age. One Saturday morning, while making tea, he felt slightly dizzy. He noticed his lips felt numb, and the hand holding the teapot felt heavy and difficult to control. He thought, "I'm just sleep deprived," and tried to sit down. That complacency nearly cost him his life and his independence. His daughter, Sarah, a nurse, arrived for a visit and immediately recognized the signs. She knew that during a stroke, time is gold, and time is brain. Any delay increases the risk of permanent disability and mortality. We will use Leonard's story to learn the 5 life-saving commands our body sends. Part 1. The 4 life-saving commands of the F.A.S.T formula. The golden rule for recognizing a stroke is the F.A.S.T formula: face, arms, speech, time. These are the 4 easiest signs to check. 1. Command F face drooping. This is the clearest sign. It occurs when facial muscles on one side of the body are paralyzed or weakened due to nerve damage in the brain. How to check? Ask the person to smile widely or show their teeth. If one side of the mouth droops or cannot move, it is a dangerous sign. Neurological principles explain this. The nerves controlling facial muscles cross over to the opposite hemisphere of the brain. Damage in the left hemisphere will affect the right side of the face, and vice versa. Mr. Leonard felt his lips slightly numb, but he ignored it. 2. Command A arm weakness. The sign: sudden weakness or numbness on one side of the arm, leg, or both. How to check? Ask the person to raise both arms high and hold them for about 10 seconds. If one arm slowly drifts down or cannot be held up, it is an emergency signal. Neurological principles explain that a lack of blood flow to the motor cortex region of the brain has interrupted the signal transmission to the limbs. 3. Command S. Speech difficulty. The sign: slurred speech, difficulty speaking, incomprehensible words, or the person cannot understand what you are saying. How to check? Ask the person to repeat a simple sentence, for example, "The sky is blue today." If their speech is slurred, unclear, or they cannot repeat the sentence, treat it as irrefutable evidence. This indicates damage in the brain region controlling language, Broca's area or Wernicke's area. 4. Command T. Time to call emergency. If you detect any of the 3 signs above, act immediately. The time is brain principle. Delaying treatment by even a few minutes can be the difference between full recovery and permanent damage. According to the National Stroke Association, NSA, you must call emergency services, 911 or local number, right away, and remember the exact time the symptoms began. Part 2. The 5th sign. The silent warning often missed besides the classic F.A.S.T formula. There's one sign often overlooked but critically important: sudden vision change. 5. The 5th sign. Sudden vision loss or double vision. The sign: vision suddenly blurring, seeing flashing lights, or losing vision in one part of one eye, like a black curtain. The underlying risk. While we often associate a stroke with limb function, it can happen in the area of the brain that processes vision. Sarah's advice: if you experience any sudden vision change, even if it lasts only a few seconds, treat it as a medical emergency. Part 3. The Ultimate Lesson: Caregiver Action. Mr. Leonard's lesson is not just for himself, but for caregivers and family. Sarah, his daughter, saved his life because she knew F.A.S.T. and refused to accept her father's self-diagnosis. The Rapid Action Principle. Log the time. If you are a caregiver, accurately note the precise time the symptoms began. Last known well time. Do not give aspirin. Unless specifically instructed by a physician, do not give the victim aspirin. If the stroke is hemorrhagic, bleeding in the brain, aspirin can be fatal. Safety position. Keep the victim in a comfortable position, with the head slightly elevated, and do not let them eat or drink anything. Mr. Leonard was lucky. Thanks to Sarah's intervention, he recovered almost completely. He learned that knowledge of stroke symptoms is a family responsibility. Are you ready to memorize the F.A.S.T. formula and these 5 life-saving signs? Practice them with your loved ones today. If you found peace in this message, please hit like to spread the message, and subscribe to the channel so we can continue this journey together.